Welcome to Enloe's 2022 Quality Summit. I'm Sean Liston, an ophthalmologist at Chico Eye Center and the chair of the Quality Improvement Committee here at Enloe. The Quality Summit is an opportunity for the whole organization to come together and acknowledge and celebrate the quality care that we provide our community. It started in 2009 when we made the decision that we needed to not only identify opportunities for us to get better, we wanted to celebrate our successes as well. Today, we recognize the 70 contributions to quality improvement just this year alone, across almost every single department here at Enloe. These posters have been on display for the public to see over the last few weeks because we are proud of the care that we provide our community. This is what quality looks like when an independent, not-for-profit hospital sees what needs to get done and does it. This is a hospital and a community full of people willing to set high goals and work hard to achieve them. And it isn't just us saying that. We are being recognized regionally and nationally for the person-centered care we provide. Just to give you a snapshot of the awards Enloe has received just since the beginning of the pandemic, Enloe was named in the top 250 hospitals in the country. That's the top 5% in the country. We were named in Forbes' list for America's best in-state employers for California. We continue to earn an A grade for patient safety. We've been recognized by U.S. News and World Report for being the best in our region in 9 different types of care that we provide our community. Additionally, out of approximately 800 Plaintree person-centered care affiliates in 30 countries, 177 of them are certified either bronze, silver, or gold. 90 are gold certified, and 7 are gold with distinction. And I'm happy to share with you that you can count Enloe among the latter. We will receive our Plaintree Gold Certified with Distinction Award at the 2022 International Conference of Person-Centered Care at the end of this month. Obviously, COVID has had and will have a lasting impact on all of us, including our organization. And you can see that in some of the posters we have on display here in the park. When it seemed like the guidance for all things COVID seemed to change on a daily basis, at least with our visitation policy, we were able to quickly adapt to adhere to the guidelines handed down by our public health colleagues while maintaining that person-centered care that we're being recognized for with the Plaintree organization. Enloe played a major role in the COVID vaccination effort. And despite giving approximately 20,000 vaccinations to our community with 5 different doses in multiple settings, not a single medication error was made. That's pretty impressive. Mental health in our area has been a significant area of concern for the past several years in light of the shared trauma our community has experienced due to multiple crises, including, obviously, the Camp Fire. This was further exacerbated among our pediatric and adolescent population during COVID with the increased isolation we all experienced. The number of children presenting to our emergency department increased 65% in 2020, more than double the national average. So the organization had to pivot to provide care to these kids in crisis. And that included having occupational therapists create specific interventions for these kids in crisis and then coordinate with our pediatrics department to expedite and deliver care on the peds unit whenever that was possible. Finally, in my role as president of Healthy Rural California, the nonprofit foundation affiliated with the Buchland Medical Society, I had the distinct honor of presenting the Andy Miller Public Health Excellence Award to the Monoclonal Antibody Program, or MAB. The MAB program, I can't say enough about. It was a collaboration between multiple departments, including pharmacy and nursing. They provided treatment to members in our community, and that treatment not only prevented hospitalizations, it saved lives. And it served as a model for other hospitals in our region. In fact, I had a patient I saw a few weeks ago in my own clinic. The patient had a heart transplant that was done by the team at the University of California, San Francisco. Her team contacted her and said she needed to go and get the prophylactic MAB treatment for COVID. They also told her she would need to find a nearby academic center, and they could take care of her at UCSF, or they could take care of her at UC Davis, whichever was easiest or closest for her. She told me that, and I was able to tell her, actually, Enloe provides that treatment. You can just go down the street and get that very treatment right here at Enloe. So as the heart transplant surgeon had told her, she would need to find a world-class institution in order to get that treatment. And I guess they were right. It's just right there. Over the last 2 years, it seems like it's all been COVID, 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 all the time. However, only 13 of the posters behind me, of the 70 posters, dealt with COVID. So in the spirit of saying, but wait, there's more, I've asked Enloe's Chief Medical Officer, Dr. Marcia Nelson, to come and share some highlights from this year's posters that aren't COVID related. Dr. Nelson?
Thanks, Dr. Liston, and thanks to everyone joining us in person and online for this celebration. So yes, was there anything going on in healthcare besides COVID last year? It might not feel that way, but these posters tell a very different story. We took care of patients with COVID and patients who had strokes. We improved patient outcomes and improved patient access. The story of 2021 is really one of and. So let me share some of what we did while we were focused on COVID and all the other important details you count on us for. So first, let's talk about raising the bar on patient outcomes. When treating trauma patients, time is of the essence, and in the emergency department, they can perform a bedside ultrasound called a FAST scan to rapidly identify free fluid in the abdomen, such as blood, that can indicate serious or life-threatening injuries. In just an average of 11 minutes after arrival at the emergency department, an initial diagnosis is made, and after that, in just 9 minutes, patients are on their way to the OR or to additional studies or treatments. Our total joint replacement program is all about safe, efficient patient care, and more these patients go home after a knee or hip replacement, either the same day or the day after surgery. This requires a finely tuned team approach that starts with the patient and family pre-surgical testing and education, continues through the hospital stay, and extends to outpatient therapies. Orchestrating this multi-specialty effort has allowed 138 of our 2021 knee and hip replacement patients to go home the same day of their surgery, including my husband. And 79% of those patients who stay overnight, they go home the next day. With these efficiencies, we have saved over $3.5 million in 1 year, which frees up these resources to care for even more patients. Patient and family experience is always a priority for us. Like Dr. Liston said, we value person-centered care. Nursing staff on the cardiovascular care unit introduced what they call purposeful rounding. This lets them anticipate and proactively address patient needs, and they showed a 20% improvement in how patients feel about their call button response and a 31% improvement in getting timely care for personal needs. So we all know that getting blood drawn can cause stress. That's true for adults, and imagine what it's like for kids. The pediatric nurses created a poke plan. They create it with their young patients where they talk to them before they get their blood drawn and identify how the patient wants to be positioned, distracted, and comforted when they get these blood tests done. It's so simple. They just find out what the patients want by talking to them. And because of that, children are a lot less fearful, and the parents are less anxious too. So in case you wondered, Enloe isn't just an acute care hospital. We have 53 outpatient clinics and services in addition to the acute care services. And as part of our mission to improve the quality of your life through patient-centered care, we instill that culture in every corner of the organization. At Prompt Care, they recognized they had a big opportunity to improve care by improving how they do their initial assessments of patients, and that's called triage. From 2021 to 2022, they cut the percent of patients who needed to be referred over to the emergency department almost in half and improved patient satisfaction with the care they received. Cancer care is all about the latest treatments, but it's also about connecting patients with services to thrive during and beyond care. And in just 1 year, the time from referring patients with cancer to these survivorship services decreased from 30 to 40 days to just under 3 days. And a new patient program was created that linked these cancer patients with over $3 million of additional financial assistance in the first 6 months of its existence. And that improved access to cancer care. And on top of this, behind all of you, we're even helping the environment by installing fuel cells that decreased energy consumption by 27%. So yes, we did COVID and everything else. Yay for us. So you might remember that we have been on this Quality Summit journey since 2009. For those of you who've been following it since the beginning, you may remember we used to call out specific organizational initiatives to prioritize over the next year. We did that in order to develop the rigor around planning improvements, doing the hard work, studying the results, and then embedding them into new processes in our everyday activities. Since 2009, unit-based quality improvement projects have just become the norm here at Enloe. This kind of work is the rule, not the exception. I like to think we've learned how to take best practices and turn them into Enloe practices. The Quality Summit helped make that happen. Because we have all become so much better at identifying and improving, we no longer call out specific projects to work on over the next year. That's because we're already doing that. It's how we do quality at Enloe. Rest assured, we will come back every year to share our progress on dozens and dozens of projects. And now I'd like to introduce our CEO, Mike Wiltermuth, and he'd like to recognize some folks for their exceptional work over this past year. Mike?
Well, I get the fun part. I get to announce to you the winner of the Quality Summit. Just before I do, I would like to just put an exclamation point on what Dr. Nelson and Dr. Liston said about quality initiatives, our organization, and the great work that's been done, especially over the last couple of years when our communities face so many challenges. These awards that we win, they're not just to put in a trophy case. They're really, I think, an indication of the culture that we've been able to develop over the years. And I think the initiatives that our departments have taken individually through COVID and campfires and floods and computer hacks and all the other things that we've dealt with over the last couple of years really, to me, just emphasize the fact that it's really ingrained in our culture to try to do the right thing, which I think is what we're all about. And, I do appreciate what Dr. Nelson said about best practices. I think a lot of Enloe practices are best practices, and I think we can take great pride in that. Everybody's got a piece of this, including our community, which has supported us over the years and, let us make our mistakes in some cases, reminded us where we've kind of gone astray and helped us refocus our attention on what matters most, which is quality, safety, and service to our community. Last year, we touched on the tremendous impact of the Substance Use Navigator Program, or SUN program, that connects people with help for substance use disorders. In 2021, our emergency department saw 75% more patients with opioid use disorder than in 2019, before the pandemic started. Our SUN program kept up with that growth and helped 75% more patients start medical treatment to escape addiction. This year, we saw the benefits of another program that helped the most vulnerable of our patients impacted by the opioid crisis. We saw our neonatal ICU's Eat, Sleep, and Console program help babies born under the influence of opioids from prenatal exposure. These youngest patients used to stay in the hospital for up to 7 weeks and receive over 80 milligrams of morphine to help transition them safely from opioids. Now, because of this program, they are typically discharged within 1 week and require 10 milligrams or less of morphine. It's with great pleasure that we announce the Mother Baby Care Center as the winner of this year's Quality Summit. And accepting for Mother Baby, I would like to invite pediatrician Dr. Amy Dolinar, as well as Julie Mayer, or one of our nurse practitioners, to accept the award. And actually, if we could invite all the leadership team up. Thank you. Congratulations to everybody. Handshakes all around. Shake, shake.
You want to hold it? Okay. Hello, welcome everybody. As we all know, the narcotics epidemic has hit Butte and surrounding counties hard. It affects everyone, but perhaps none more innocent than the vulnerable newborn population. Until recently, these babies often required treatment for longer than many other critically ill infants. Treatment courses ungainly and difficult for all involved. Many times, the treatment was almost worse than the cure. It is in this mindset that the pediatric hospitalists went about changing the paradigm of neonatal abstinence or drug withdrawal care in our newborn nursery and neonatal ICU. In 2017, nurse manager Shannon Doyle, pediatric nurse practitioner Kelsey Everson, and myself attended a hospitalist CME conference that introduced a new way to treat drug-exposed infants. You see, we were and are not the only ones who were frustrated with this long duration and frustrating outcomes of treatment. At this conference, we were introduced to the concept of Eat, Sleep, and Console, or ESC, as a different way to conceptualize the care of these little ones. The preliminary statistics that were being reported were almost too good to be true. The typical course of treatment for neonatal abstinence often involved prolonged reliance on pharmacology, that is morphine, to help wean, quote unquote, these infants to a, quote, normal infancy. Many infants were separated from their mothers and cared for in an ICU or higher level of care. Eat, Sleep, Console is totally different. It involves teaching the parent or guardian how to soothe and care for their newborn as the baby goes through withdrawal. A few months later, we added nurse practitioner Julie Mayer to our pediatric hospital staff. We had another opportunity to explore the concept of Eat, Sleep, Console for ourselves. Julie and Shannon attended a live stream conference by Dr. Grossman, the founder of ESC, and we all got more inspired. Julie, in coordination with our expanding hospitalist team, became the driving force behind this need for change. She worked especially hard to help us implement ESC. What we ultimately found is that babies who previously would stay in an average of 4 to 6 weeks can now be discharged within 5 to 7 days. The longest stay we've seen since we've implemented ESC is 2 weeks. Our use of pharmacology, or morphine, has decreased from hundreds of doses per patient to a few doses or even 0 doses. Meanwhile, care shifted from separating and alienating parents and families to empowering and encouraging maternal care and support, garnering greater success for both mothers and babies in long-term outcome studies. Over the last 3 years, in spite of local disasters and a global pandemic, we in Mother Baby have moved our quality of care forward. We brought on board and trained cuddler care volunteers for times when parents or families are not available. We worked with a substance use navigator to help support and treat effective mothers and families. We trained medical staff, nursing, and providers in this program to help bring about a holistic culture of change to our organization. We worked together as an Enloe family to build a care model based on love. I would like to let Julie share more about this effort. Julie started out in the ER at age 16 and spent 5 years as an EMT, unit clerk, and monitor tech. She planned to stay in ED, but learned that they didn't hire nurses without critical care experience. So she transferred to the NICU. She worked for 5 years in a level 3 NICU and floated to the PICU as an RN. In 1993, she moved to Oroville and started at Oroville Hospital's ED, where she stayed until 2016, when she graduated from nurse practitioner school with a special emphasis in pediatrics and neonates. She went to work as a pediatric hospitalist initially at Mad River up in Humboldt County, where she continues on a monthly basis. And in 2018, we were lucky to have her come join us here at Enloe. I'm proud to welcome Julie Maurer.
I would like to start by saying thank you to Enloe Medical Center for being the hospital that truly cares about both its patients and its staff. The Plaintree model of empowering patients and families through information and education and encouraging healing partnerships with caregivers is the exact reason we're here today. Second, I would like to say thank you to this amazing and extraordinary group of women that I stand here with today. It's because of you guys that I can honestly say... And Jake. It's because of you guys that I can honestly say this is my dream job. In 1987, I was a young and inexperienced nurse working in a neonatal intensive unit of a large teaching hospital. I took care of substance exposed newborns almost every day. They were fussy and spitty and miserable, and the course of care was always the same. Do the Finnegan abstinence scoring, give scheduled doses of narcotics based on those scores, and then feed them and tuck them back in the bassinets and hope that they would stay calm and quiet until the next feeding, because we had a lot of other babies to take care of. I never questioned it. Parents were rarely at the bedside, and these babies remained in the NICU for weeks and even months. They almost never went home with their mothers because they weren't encouraged to take any responsibility for them. There was little incentive for them to visit, and when they did, we frankly made them feel worse because of their substance use, and everybody was frustrated. These babies received hundreds of doses of the same narcotics that we were trying to wean them from. Finnegan scoring was developed in the 1970s as a laundry list of symptoms to use to help recognize withdrawal in infants. Behaviors like sneezing, yawning, jitteriness, crying, poor feeding were scored as signs that the baby was withdrawing. The scoring system was never intended to be used as a tool to monitor progress of withdrawal or to decide if an infant needed more or less narcotics, but because nurses and doctors love numbers and absolutes, we clung to these scores and we let them drive treatment, and we lost sight of reason. Fast forward 25 years to my return to newborn medicine as a nurse practitioner, and guess what? We were doing the exact same thing. Endless doses of narcotics, mothers who felt judged and alienated and did not come around much, and nurses who were frustrated with trying to take care of these high-needs infants for weeks and still take care of the other babies who came and went much more quickly. These babies had the longest stays of any pediatric inpatients except extremely premature infants, even longer than patients with heart transplants. There had to be a better way. In 2018, I was privileged to attend a seminar put on by the Butte County Opioid Coalition, addressing substance abuse in pregnancy. One of the speakers was Dr. Matthew Grossman from Yale New Haven Children's Hospital in Boston. He was implementing a new approach, as we've talked about, to dealing with substance-exposed infants called Eat, Sleep, and Console. The first thing he said was, treat the baby like a baby and treat the mother like a mother. That sounded intriguingly simple. He shared the story of his first child, who was very fussy from birth. He did not sleep independently for weeks, and he cried inconsolably. He and his wife took turns, one sleeping while the other soothed and shushed the newborn. He supposed that if he had taken the infant to the pediatrician for his extreme fussiness, the doctor wouldn't have said, let's give him round-the-clock doses of narcotics. Dr. Grossman and his team brainstormed and determined that newborns really have 3 basic needs. They need to eat to sustain life, they need to sleep, and they need to be able to be comforted. Mothers have a need to be supported and empowered to successfully care for their infants, whether they're substance users or not. Dr. Grossman and his team developed a basic, sensible plan for care of these infants. They switched the focus from management with medication to maximizing non-pharmacological treatment, including holding, feeding, soothing, and providing low stimulus environments. They considered that to be 90 to 100% of the intervention that withdrawing infants need. After this conference, mother, baby, peds, and NICU directors and providers and nurses started looking objectively at the way we were handling substance-exposed newborns. We asked questions like, what preconceived judgments did we have about the substance-using mothers, and what could we do to change them? How could we encourage mothers to be at the bedside more often? And how could we care for these infants when the mothers were not at the bedside? And more importantly, how could we keep from giving them all these already exposed newborns these doses of narcotics? We went on a fact-finding mission and learned that even the longest-acting opioid has an actual physical withdrawal period of less than a week. And if we could support these newborns through that week, they could be discharged without pharmacologic intervention. We recognize that newborns do not have the psychological challenges of getting sober that plague substance-abusing adults who know how hard it is to withdraw and are afraid of relapsing. We realized that normal newborn behaviors were being pathologized just because we knew that they had been substance exposed. So babies were doing normal things and we were thinking, oh my gosh, that's from withdrawal. We learned that mothers who are using substances will likely continue to use if they leave the hospital without their babies. But mothers who were encouraged to bond with their babies at birth were more likely to seek recovery and remain sober even if their newborns went initially to foster care. These mothers are often able to regain custody later, and this time of bonding at birth proved critical in their parenting success. Eat, Sleep, and Console involves teaching the parent how to soothe and care for their newborn through the withdrawal and on to home. It takes the focus away from medicating and shifts it to loving and nurturing support of both the parent and the newborn as they work through the withdrawal process. It makes the nurse a parenting coach, and it really works. We started this program for opiate-addicted newborns, but we quickly found that the principles work for any type of prenatal exposure: tobacco, marijuana, antidepressants, methamphetamine. Since implementing our Eat, Sleep, and Console protocol, as we talked about already, our length of stays have dropped from 4 to 6 weeks to 5 to 7 days, and most newborns now receive 0 to 5 doses of narcotics as needed instead of over 100. Rather than blaming and alienating parents, the focus has shifted to encouraging them and providing them with the tools they need to take care of their baby. When we keep mom and baby together and the mother active in the care of the newborn, they both have a much greater chance of success. We believe that giving mothers and fathers too tools to use and an incentive to stay sober can affect generations of change in the family. The Eat, Sleep, and Console program focuses on several key efforts: providing prenatal teaching about the birth and care of the newborns that are born to substance-using mothers, providing mothers resources to get and stay sober after discharge, finding a feeding plan that works for the baby, and setting up an environment that decreases stress and optimizes newborn sleep. And also, we train parents on soothing and consoling techniques, both in the hospital and to use at home. We implemented our new care model in a stepwise approach. We trained nurses and providers by asking them to view Dr. Grossman's conference. We trained cuddler care volunteers to snuggle with babies in those times that mothers couldn't be at the bedside. We worked with the substance use navigator to provide parental support and resources. We discussed and changed again current policies and procedures. We addressed concerns from our very experienced and talented NICU nurses. Then a year ago, we implemented these new procedures. After 3 years of work, we have seen a dramatic decrease in the length of stay and a successful culture change in our organization. Our babies are happy, our parents are happy, our nurses are happy, and we have built a care model that changes the trajectory of these families. Thank you.
Thank you.
Thanks for that. Honestly, when I first read the poster, I thought that was a typo going from weeks to days, but I was mistaken. So that's awesome. Well, thank you today for attending today's 2022 Quality Summit. If we can say that the Quality Summit is successful, it's because of all of the work that everybody behind every single one of these posters behind me put into doing the work and then presenting it, not only to us here and online, but to our community, as we've done over the past couple of weeks. So really, we should applaud everybody who put forth the effort. The posters and today's live stream will be available to view on www.enloe.org/Quality Summit, all one word. And hopefully it's on the screen right next to me. Right there? It's down. It's down there. But the work is not done, nor will it ever be done. So join us again next year and see everything that we have continued to work on to improve. That's it, everybody. Good evening.